Hello, I'm Eric Ricchetti, Director of the Shoulder Center in the Department of Orthopedic Surgery at the Cleveland Clinic. I'll be presenting this interesting case of addressing glenoid bone deficiency and revision shoulder arthroplasty. This is a 74-year-old female who presented 7 years out from right total shoulder arthroplasty. She initially did well after surgery but has developed increased symptoms over the last 1 to 2 years. Her examination shows pain-limited function, and her x-rays raise concern for both humeral and glenoid component loosening. When we compare the current films to her immediate postoperative films, you can see evidence of subsidence of her humeral component with associated loosening, as well as signs of glenoid component loosening with associated medial calcar osteolysis. Her workup for revision shoulder arthroplasty included ruling out infection, and she had normal serum inflammatory markers with a negative shoulder aspiration. We also obtained a preoperative CAT scan to better evaluate her glenoid bone loss. You can see on both the axial and coronal images evidence of significant glenoid bone loss both centrally through the vault as well as posteriorly with an uncontained defect and loss of the posterior glenoid vault wall as shown here. Based on these findings, we elected to proceed with revision to reverse total shoulder arthroplasty and addressing this large uncontained defect with a structural autograft using iliac crest. Intraoperatively, you can see placement of the iliac crest autograft here to address both the central bone loss and the posterior uncontained bone loss, and then placement of our base plate on both the structural autograft and native bone. Postoperatively, her intraoperative cultures were negative with no concerns for infection. She recovered well. You can see her postoperative x-rays here. At 4-year follow-up, she's shown to be doing very well functionally, and you can see on her most recent x-rays incorporation of the iliac crest native autograft. We've published on our series of patients that have undergone bone grafting in the setting of revision for reverse total shoulder arthroplasty and compared those that had structural autograft to those who had non-structural allograft for uncontained versus contained defects. And at minimum 2-year follow-up, both groups showed very good outcomes with regards to patient-reported outcome scores and good incorporation of the bone grafts. Thank you.